issue that any of us could run into this summer if you've got a trip planned, say you were going to Zurich or Milan, but then you test positive for COVID-19. So our 9 Health expert, Dr. Payal Kohli, back with us today. So what happens now? It seems like it's rising again. Maybe you haven't been down this road. You develop symptoms. What do you do?
The 3 T's, which we seem to have forgotten about: testing, tracing, and treatment. Remember, we had been talking about those all along.
Yeah.
So the first and most important thing with symptoms, test. So make sure you have some rapid tests with you. If you have symptoms that rapid test comes out negative, you got to go get a PCR test. If you have symptoms and the rapid is positive, you can stop right there and get to the second T, which is tracing. So dial back the last 5 to 7 days, who you came into contact with. Might be a little difficult for Eric Clapton, as he's on tour. Came into contact with a lot of people, but for most of us, we sort of know what we did looking in our calendar. Call those people and tell them you tested positive. And then the final T is treatment. Don't just sit there and wait for the virus to do its thing. There are many of us that are eligible for treatments that could change the course of our disease.
Quick question, when you talk about tracing, when you said you go back to, I thought you were trying to find out where you might have gotten it. What you're trying to do is warn people that you have it and probably had it when you were with them.
That's exactly right, because it's impossible to know where you got it.
Right.
We know the incubation period, or the time from exposure to symptoms, can be as little as 2 days and as much as 14 days. A little shorter for Omicron, but it's very difficult to know.
So it's like, be a good human, tell somebody, I guess.
Let them know.
Yeah.
And don't be ashamed. A lot of people worry that people are going to
do.
judge them. We're not in that stage anymore.
Yeah, we're not there. But when you mention treatment, there are a lot of treatment options out there now, better treatments.
There are, and they're different. So the monoclonal antibodies that we were all reaching for before, the FDA has actually revoked authorization for some of these against the Omicron variant because they're not working. So the main treatment that I'm thinking about is Paxlovid, which is the antiviral, kind of like a Tamiflu, which is the antiviral for the flu, but for COVID instead. And it's really important to start this within 5 days of symptom onset, because that's when it can reduce your risk of hospitalization by 89% if you're high risk. Now, many times I say high risk and people think cancer or heart disease or some sort of chronic illness, but anyone over 65 qualifies as high risk.
Is it available? Is it, because we always talk about what is and what you can't find. Paxlovid's available right now?
Very much so. And Walgreens and CVS are both expanding their supply, and the supply chain issues have really gotten better. So now I'm seeing patients getting it all the time. I'm writing it for my high-risk patients, and there's been no problem at all.
So for those of us that are traveling, and so many people are, I mean, the airport's already, people are gone. What do you do? And what should we do as we prepare? It's a little different than, say, pack sunscreen. You know?
You should pack the sunscreen.
That too.
Yes. I think the most important thing is we can travel this summer now that we have the vaccinations on our side, but we have to be safe as we do it. So first, go get boosted. If you're eligible to get the booster and you haven't yet gotten it, it's been more than 6 months since your last dose. The official guideline is 4 months, but 6 months is the upper limit. You need to go get that booster before you travel. Pack lots of rapid tests. You do not want to be caught somewhere without a rapid test, so have a supply of at least 8 to 10 rapid tests with you. And then make sure if you're immunocompromised, you have a way to get Paxlovid, because if you're traveling internationally or what have you, you may not be able to get that antiviral.
Quickly, would you recommend anyone get Paxlovid, or can you get it preemptively, like before you are sick?
It's been studied. So Pfizer actually looked at this data, giving it to close contacts of people that tested positive. And it did reduce the rate of infection by about 32 to 37%.
I just meant to have it on hand, like if you suddenly find yourself testing positive, that you could self-administer, or is it something you need to wait till you're sick to take?
No, in fact, just this morning, the commissioner of the FDA said we need to start moving up the timeline of when we're giving it to people. So high-risk people, the minute they test positive, even before they have the symptoms, should be taking that Paxlovid, and that includes anyone over the age of 65.
All right. Thanks very much. Always good to see you, Dr. Payal Kohli.